Hello.
Hello.
Is that Sherry?
Yes, it is.
Hi, and is Dr. Gabriel with you?
Yes, I am. Hi, Dr. Goodwin.
Yes. How are you both this morning?
We're doing great. How are you?
Okay, I guess it's afternoon. Where are you based?
We're in Vancouver, Washington, Portland, Oregon area.
Oh, okay. So yes, it's morning here, and it's earlier morning there. Well, it's great to have a chance to talk with both of you this morning. As you know, this is Breast Cancer Awareness Month, so it's a very timely opportunity for us to talk some about breast cancer, and for that matter, to talk about breast cancer in a different way than most discussions go. Typical discussions talk about prevention, early detection, and in some cases, mastectomy, but we don't have much discussion about breast reconstruction and reconstructive surgery, although from my vantage point and from Health Power's vantage point, that's a very important part of the overall spectrum of what we need to be thinking about and talking about when we talk about breast cancer. Um, what I want to have us do is to talk more this morning about breast reconstruction, and I'm aware that Dr. Gabriel, you're a board certified plastic surgeon who, in a sense, specializes in breast reconstruction. So there's much that people, women especially, would like to know about this. And Sherry, that you're a breast cancer survivor, and it's always important to hear from breast cancer survivors. So are we ready to go?
Yes.
Okay. Dr. Gabriel, how common is it for women to choose to have a mastectomy or a double mastectomy, and what are the main reasons they have them?
Dr. Goodwin, most women, when they're diagnosed with breast cancer, will undergo some type of a procedure to remove the breast cancer. Well, the research is showing that double mastectomies have increased over the last 10 years by about 17% a year. As you stated, 17% per year. And that is a lot. And as you stated so eloquently earlier, in terms of breast reconstruction is a very important part of the overall cancer journey. And sometimes it is understated. Now, having said that, does not mean every patient will have reconstruction or wants to have reconstruction. But what we're here today is to help listeners understand that breast reconstruction is an option for patients who have been diagnosed with either breast cancer or have a high risk family history, or they're gene positive and decide to have a double mastectomy or a one-sided mastectomy.
Yes. Let me ask you one other thing about this. Of course, I didn't mention it before, but part of the journey is lumpectomy and then single mastectomy and then double mastectomy. Could you kind of run through that a little bit in terms of when women, when it's best indicated to get each?
Dr. Goodwin, I can't comment on the reconstructive options of the lumpectomy and mastectomy, but as a plastic surgeon, I will let my breast surgeon, surgical oncologist comment because they are the ones that make those decisions with the patient. The one thing that I can say, if the patient is having only part of their breast removed, which is a lumpectomy, or having the entire breast removed, which is a mastectomy, they both can have reconstruction. Just the important thing is start the reconstructive process early, especially in the lumpectomy patient. If they decide to have a lumpectomy, the reconstructive consultation needs to happen even prior to the lumpectomy or very soon after the lumpectomy before radiation is being performed.
So it should happen before radiation.
Ideally, yes, that is what if a patient is having a lumpectomy.
Okay. And so let's have you talk to us a little bit about the reconstructive surgery. As I understand what you're saying, and it's a very appropriate answer, is you leave it to the oncologist to talk about what when you get each one of those. But on the other hand, your specialty is deciding how to make that woman both feel good and look good after she has had whichever one she decides to get.
Absolutely. So, in terms of what happens when a mastectomy is performed, is all the breast tissue is removed. Now, the patient can decide to have immediate reconstruction, which is reconstruction at time of mastectomy. So, some people need to know that it can be done at the time of mastectomy, or some patients choose to have the reconstruction performed at a later time, and that is fine too. It can be months to years down the road. Goal of breast reconstruction to rebuild the breast and make women whole again. Over the last 10 years, we've seen a large increase in surgical innovations, techniques, and products that have become available to better help us create the shape, to create the breast shape. Now, having said that, all these techniques have only made our breast reconstruction efforts, breast reconstruction results better.
Okay. So tell us something. I'm sure I'm going to get to you in just a moment. I just want to take advantage of our opportunity with Dr. Gabriel to use his expertise to tell us a little bit more about Reconstruction, and I'll come back to him later. What do you do, Dr. Gabriel, when you do breast reconstruction? Is this complicated surgery? How do you decide on the shape? How do you decide on the size? Issues like that.
Well, it's an exciting time for us to be involved in this decision-making process with the patients. We don't necessarily discuss the size and shape early on when the patient is going through the emotional aspect of this devastating diagnosis that they have received. But we use an expander, as we tell them, as a temporary sizer, so we can guide our size and shape for the future. Now, during the early period, during the early on, some of the innovative products that I use is the alloderm tissue matrix, which is brought to you by Acelity, who we have partnered with today to educate patients about breast reconstruction, as well as some of the fat grafting and fat grafting techniques and processors that all have helped us to improve our reconstruction. Now,
did you say an expander?
Expander, yes.
Okay, and the expander does what?
When the expander is placed into the pocket after the mastectomy, whether again if it's immediate or delayed, it will be the new footprint, the new area where the implant is going to reside, end up staying at. But what the expander does is I tell my patients is a temporary sizer. So I don't want them to worry about size early on, because they don't care about size. They're worried about their breast cancer. So we use that expander as our temporary sizer to size them in the future to see what desired shape they want.
Okay, and how long is it between putting in the expander and then going ahead with the actual reconstruction?
So the expander starts the reconstructive period already. So the first stage reconstruction is the expander with the alloderm that is used, the alloderm tissue matrix. The second stage, we wait about 3 months if the patient is not having any chemotherapy or radiation. Obviously, if she's having any type of additional treatments, things are going to change, and time frames will vary depending on the treatment. Second stage, the implant is chosen with the patient, and then the expander is removed and the implant is placed, and this is when fat grafting is performed to additionally improve the shape of the breast.
All right. So we'll come back. Sherry, tell us about your journey with breast cancer, when it was diagnosed, and when you decided to get reconstruction, and how your reconstruction went.
I was diagnosed 3.5 years ago, and at the time of my diagnosis, my surgeon offered me a few options as far as my treatment's concerned. And after pondering all the
Wait, what were the options?
I could have had a lumpectomy with radiation and 10 years of oral chemo. I could have had a single mastectomy or a double mastectomy.
Okay. Hello?
Yes?
Okay. So you had that full, and how did you decide?
I wanted to attack this cancer feeling whole and normal again, and that option to have a double mastectomy with a reconstruction felt right for me. So by having that, my breast restored, it gave me some emotional strength that I probably wouldn't have had otherwise. And this is my situation only. So I feel like it was a great tool that I had in my emotional recovery from the trauma of breast cancer.
So am I understanding you had a double mastectomy?
Yes.
Okay. And did you have the double mastectomy to just feel free of cancer, or to have symmetry in terms of your breast appearance, or did you have genetic factors that made you think you might get cancer in the other breast? What most influenced you?
I had no genetic factors that were in my decision. My main goal and my biggest decisive decision, I wanted to feel whole and normal again. I didn't want to have breast cancer look me in the face every day, because I felt like I needed that aspect so I could move on and just be a normal person again.
And I gather that has happened. Is that correct?
You bet, 100%.
That's wonderful. I'm glad to hear that. I know reconstruction surgeons are doing a very important job in helping women to feel whole and normal again.
Absolutely.
What advice would you give to other women in terms of what other women who have breast cancer?
They need to really question their doctors, educate themselves in regards to their treatment options as far as reconstruction is concerned. Talk to other breast cancer patients, access local breast cancer support groups for mentoring. Look on the website. More and more information is getting out there. They need to be informed for the right decision.
Which website are you referring to?
The website that she's referring to, Dr. Goodwin, is breastreconstructionmatters.com, and it's a very comprehensive website.
Slow down. I want to have us share this with our audience so that the Health Power audience will know how to get there. It's called
breastreconstructionmatters.com.
Okay, breastreconstructionmatters.com. Okay,
Yes.
That's good. Now go ahead.
So, Dr. Goodwin, this is a great website for patients to go to, for you send your listeners to, for finding more information about what's out there. Because patients, if they're not a breast cancer survivor, they know somebody that has been diagnosed, coworker, a family member, and it's important for them to be able to educated on what is out there now, what is available to them. And yes, they do have the option, because they deserve to know all this information, because as you know, knowledge is power, and we want to make sure that everyone has this information at hand.
All right. Dr. Gabriel, another question. Is breast reconstruction surgery generally covered by health insurance?
Dr. Goodwin, yes, it is. It's covered by the plan. It depends on what health insurance plan the patient has, but because of the federal mandate in 1998, insurance companies do cover breast reconstruction.
And does that include the Affordable Care Act?
Yes, it does.
That's wonderful. That's something else women should know, you know.
Oh, absolutely, and that's why we're so thankful you've had us on your show, and we really appreciate you passing this information to your listeners and to all women, that hopefully they can pass this information to other patients, to other friends, that can feel empowered to make the right decision for their future. We thank you for your time.
Yeah, what I'd like to do is to be in touch with you again so that we can put something on my website, healthpowerforminorities.com, to help minority women in particular, but all women, to know more about breast reconstruction. So I look to be back in touch with you for that.
Absolutely, we would love it. Thank you so much.
Okay, and both of you have a good day.
Thank you. You too,
you.
Dr. Goodwin.